Cyanosis. Let's learn about cyanosis. So, what is cyanosis? Cyanosis is a bluish discoloration of the nails due to increased amount of reduced hemoglobin, more than 5 mg% in capillary blood. You can see the image. Types of cyanosis. First, central cyanosis. Second, peripheral cyanosis. Third, cyanosis due to abnormal pigments. Fourth, mixed cyanosis. You can see the bluish discoloration of fingers. Now, what is central and peripheral cyanosis? Let's see. Also, keep looking at the pictures. Central cyanosis. The mechanism in central cyanosis is diminished arterial oxygen saturation. It can be seen on sites like skin, mucous membrane, tongue, lips, cheeks, etc. The temperature of the limb is warm. Clubbing and polycythemia is usually associated. On giving local heat, the cyanosis remains, and on breathing pure oxygen, the cyanosis decreases. Peripheral cyanosis. It is due to diminished flow of blood to the local part. It can be seen on sites like skin. The temperature of the limb is usually cold and is not associated with clubbing and polycythemia. On giving local heat, the cyanosis is abolished, and on breathing pure oxygen, the cyanosis persists. Mechanism of cyanosis. In an adult, on an average, there is 15 gram% of hemoglobin, 95% of which is saturated with oxygen, and only 5% is reduced. Hence, in capillaries, a mean of the two, that is only 2-3% gram, is reduced hemoglobin, and the color of the skin and mucous membrane is pink. When the amount of reduced hemoglobin exceeds 5 gram% in the capillaries, the blood appears dark and gives the tissue a bluish hue. Causes of cyanosis. First, central cyanosis. A. Cardiac causes. Congenital cyanotic heart diseases like Fallot-Stratton, etc. Congestive cardiac failure. Pulmonary causes. Chronic obstructive lung disease. Collapse and fibrosis of lung. Abdominal hepatopulmonary syndrome. High altitude due to low partial pressure of oxygen. Peripheral cyanosis. Cold local vasoconstriction. Increased viscosity of blood. Shock. Raynaud's phenomena. Mixed cyanosis. A. Acute left ventricular failure. Mitral stenosis. Cyanosis due to abnormal pigments. A. Methemoglobinemia. Second, self-hemoglobinemia. That was all about cyanosis. If there is something you want to suggest or tell us, write us in comments. Thank you so much.